True. Hello everyone, thank you so much for following us again. Reflect and Reset with Maria and Gina. And today, as always, we have an exciting show. And Gina is going to introduce our guests. I want to thank you for all of the support that you're giving us first before we start, because you guys have been amazing. You're asking a lot of questions and we're getting a lot of views, and we are hoping that the information that we bring to you is valuable to you, because that's what we're here to do, to educate and to provide health care for the community. And I'm going to stop talking and I'm going to let Gina introduce our guest.
Hi everybody, so we are here today at Slingshot Health down in the city, and you guys are probably saying, what is Slingshot Health? Well, let's look at a Priceline.com and picking your own price or bidding on a price for healthcare instead of for travel or reservations. And we're here with Dr. David Berman, who is the CEO and founder of Slingshot. And we're going to give you some explanations of what it is, what it does, how it's going to help you in the future to be able to control your spending in healthcare and keep yourselves healthy, right? So, Dr. Berman, why don't you give us a quick idea of what Slingshot actually is?
And thank you, by the way, for inviting us today to this. What you guys do is really amazing and very important to us, right?
Thank you. Dr. Berman, we are so lucky to have you. We were talking how we've been talking about this partnership for a while
About a year. It's about a year now, yeah.
And we are very excited.
So we agree with you. Your health should not depend on your wealth.
Yes.
So Slingshot Health is a healthcare marketplace where we provide access to high quality healthcare at a significant savings. We believe that your health insurance status should not determine the type of healthcare that you have access to. We provide access, affordability, and 100% transparency for all patients.
It sounds like our mission, Gina, right?
That's exactly it.
And that's why we decided to really create this partnership. Right, Gina?
Absolutely. And I think that what people need to understand is to be able to go on, and not just patients, right? We talked about providers that are interested in this type of program can also link on and become one of your providers. So patients can now go on the website, right? They go on the website, they put in what they're...
Sure. So by going to slingshothealth.com/Formé, all you need to do is put in a white plain zip code, tell us what type of service you want, and your offering gets sent out to the providers at Formé and Transformé. We're trying to fill gaps in the schedule, and by doing that, we provide them with significant savings.
That's great. And this works for anybody that has either, whether you have no insurance or you are underinsured, right?
Sure. So regardless of insurance status, we request when you join us, and we're free, by the way, there's no charge for the patient ever. So you give us a year of birth, a birth gender, and a form of payment. It could be cash, it could be credit card, a debit card, or an HSA or FSA account.
Well, that's great. And the way that this works, you go into, say it again,
slingshothealth.com/Formé. So they can see in the background. It's very simple. By putting in a white plain zip code, they have access to all the services that you provide for them, and they determine the price that they want to get that service for.
I have a question. What happens if somebody is new and doesn't know about Formé? But they heard about Slingshot, they go on Slingshot and they're looking for an urgent care center. Do they have to put Formé, or they just put Slingshot with your zip code and then you show what's available?
Sure, they can go either way, slingshothealth.com or slingshothealth.com/Formé.
Okay.
By putting that white plain zip code, it still gives them access to your providers. Yes.
And by the way, guys, so this is not just in Westchester. You're talking about in the city too. I mean, you have a lot of providers already that have joined efforts with you, correct?
Yes. So we're up and running in Manhattan. We have about 1,000 providers in almost 80 different specialties, providing almost 1,000 different services for patients.
Okay, so the other thing that I want everybody to understand is that when you bid on how much you want to pay for a specific service, then we either accept that bid, right?
That's true.
Or we counter offer you. So in other words, if you're coming in for urgent, and you have to be clear so you don't get any fees after your visit of what you're coming in for. Because if someone's coming in, generally it's just saying, I want an urgent care visit, Well, that's not enough information for us to be able to accept or not accept the bid.
So we ask the patient to tell us what they're looking for specifically. We give them an average price that we have determined looking at a bunch of different databases. They use that as guidance. They could bid less than that or more than that, depending on how sick they are or how badly they want to be seen.
Mm-hmm.
That offering goes to you, and you have a choice of either accepting it or counterbidding. So what we want is the date that they want to be seen. Could be today, could be tomorrow, could be months from now. A time window that they want to be seen in, let's say between 8 a.m. and 5 p.m.
Mm-hmm.
They put that offering in, you get it. You can either accept that price or counterbid. And when you either accept it or counterbid, you tell them exactly what time in that time window to show up.
That's great. And you were saying that it's not just medical providers, but you have dentists also.
Yes.
In aesthetic center, because we happen to have
Don't
Transformé
forget about
MD.
Transformé.
So you could also bid on aesthetic services in Slingshot.
So that's actually very big already in New York City. By offering patients access to services they may not be able to afford, or more importantly, that they think that they can afford,
Right.
they can say, you know, I can afford this much,
Right.
and let me put that bid in and see what happens, right? And we're finding that services, dentistry, dermatology, cosmetic dermatology are very big already.
And as you know, our mission is really, as we always say, our mission is your health. And this is the reason why I remember when you came up to us to talk about what you guys were doing, and this was at the beginning stages. And we talked about our medical membership, which for us, that's our baby. Gina and I live and breathe our medical membership, which our effort to really find a way to provide healthcare to the uninsured community. And when we spoke, we felt that we can unite and create different choices for the community that doesn't have insurance. Right. But in addition, like we have high deductible, Gina. This is something that I would do. You were talking about how you had some services already, dental services, and you ended up bidding on that.
So I used Slingshot Health for some jaw surgery recently, and I saved at least 50%.
Wow.
And we are really very aligned on fixing healthcare for people.
Right.
I've been practicing medicine long enough, more than 30 years. I can tell you that it used to be okay, and now it's not okay. You know, it's not front page news that healthcare is broken. And I think the fact is that when we first met, I felt a special alignment towards you guys because what you were doing to help others was very special. I think Slingshot Health actually magnifies that exponentially, that together that we can provide access to healthcare for people that would never be able to touch it. Right?
And you know what we talked about on one of our other programs was that what people don't understand is when you don't have insurance, you are charged the same rate that the offices charge the insurance company. And although they don't get that rate from the insurance company, they still expect you to pay it. So this is an unbelievable avenue for them to be able to say, I can afford to pay.
So to your point exactly, if you think health insurance billing is complicated when you receive all those EOBs once a month for 3 or 4 or 10 or 12 months, try sitting on my side, where we have to make sense of all these things that are going on all the time. We can see people with the same insurance plans that get different answers for the same service, right? It's really mind-boggling. And it's really important for people to know that we are 100% transparent. There's no hidden fees, there's no membership costs, there's nothing. They put a bid in, they bid $100, that is what they're going to be charged. That's it. Nothing, there's no paperwork. Some early reviews from patients are calling us Uber-like.
Oh, wow.
Right?
I was actually thinking of that today, because we got in an Uber to come here, because we're at their office in the city, and you get in the Uber car and then you leave, and there's no exchange of money.
No, nothing.
And how wonderful is that? So this is the same concept.
No exchange of money, no paperwork that follows you. You got what you wanted to get, you paid the price you wanted to pay, and you got the service that you requested at the time that you wanted it.
Is there a survey? Do they get to fill out a survey of how they felt?
Sure, there's feedback, and we welcome everybody's feedback too. So yes, the answer is always yes. We want to make this as good as possible for patients and providers to make everybody win.
That's terrific. I'd like to know a little bit about you because we're talking about Slingshot, but you're the man behind this idea. And tell us a little bit about your history.
Sure. So I feel very uncomfortable I'm not the man. I'm just I'm one person. I'm part of a very amazing team of growing people that really align with the vision and the mission of fixing healthcare. There's not a person around that hasn't been or hasn't had a negative experience with healthcare. It's just, if you've had an experience, it's probably not a positive one.
Right.
So me personally, I've been waking up every day for a long time just trying to make the world a better place. I happen to find my calling in healthcare. So after going to medical school, my training, and my fellowship, I came to New York. I started my own practice. And I think I'm just being led towards, instead of helping one person at a time, hopefully helping a lot of people at a time.
That's terrific. And I have to say that we met your team.
Yes.
A lot of the team members, and they're fun. They're a good group. They're young people that are just hungry, and you could tell. And they're having fun at the same time. And you said it. I mean, it takes a team. It's
Sure.
We can come up with ideas. Gina came up with the idea of the medical membership. One day
In the shower.
In the shower, but that idea was taken to the level where it is now.
Exactly.
By a team. We were very blessed.
Sure. And I will tell you that the idea popped up in my kitchen, not my shower. And it's very tough to build something of any quality, whether it be an idea into a company, without taking care of the people really well. And it's important that people know that in every room, as you saw in our office, our culture centers around humility and loving kindness. Always doing the right thing, and if we see people who are down, lifting them up, right? Always doing the right thing even when people are not looking. So it's really important for me that everybody knows that this is, this goes beyond fixing healthcare. It's about how to treat people.
That's beautiful.
Right.
Another question. So I'm assuming you have not negotiated with hospitals yet, or are you in the midst of doing that?
So we have several contracts with some major healthcare systems in northern New Jersey and Connecticut, and we should be opening also in Michigan shortly too.
What about New York?
In New York, we already have 1,000.
We need all those hospitals that we're dealing with.
So, we're always open to talking with them. We found it very easy to onboard providers in Manhattan. So, we're just trying to make it as easy as possible for people, for providers, for patients.
So you're not actually talking to you're talking to the doctors of the hospitals.
In Manhattan.
What happens if there's a surgery? Does the hospital gets involved with the facility fees, and is there, you're not?
Sure, well, in Manhattan, we're not dealing with healthcare systems, but in northern New Jersey, we're dealing with Hackensack Maria healthcare system.
Okay.
We have a contract with Prospect Medical, and they're in 6 states. We're opening in Connecticut, and we're opening with Ascension Health, which is the largest not-for-profit healthcare system in the country. They're in 22 states with 36,000 providers. So we do work with healthcare systems. To your point in terms of surgeries and procedures, I'm a gastroenterologist, so I've already accepted and done 4 procedures on patients looking for gastroenterologic procedures, colonoscopies, endoscopies. People can go also straight for other, we have a system that's been built over the last 50 years that's become very, besides broken, very sclerotic. You have to go to your internist for permission to have another test, whether it be an MRI or a blood test. With us, you can go direct for that MRI or CAT scan or blood test, right? So we're providing new ways to access healthcare for patients, again, at their cost and at their time.
So you have imaging centers also that you've negotiated with?
Well,
not negotiated with, actually,
yeah.
that are part of the providers at Slingshot Health.
Yes. So everybody has open gaps in their schedule, today, tomorrow, a week, a month from now. We take that available time and bring it to the marketplace, and for the providers, we don't charge them either. So we don't charge the patients or the providers. And by giving access to that free time, it provides us with a win-win position for the patients too. They still get high quality access to healthcare at a savings.
And for me, there's no downside. There's absolutely no downside, especially as providers in our facility, there's no downside. I'm actually saying yes or no to a price that you're offering, and I can counter, like I said, or not, but anybody who's out there who's going to be listening to this on our LinkedIn and you guys have to log in and you have to talk, register as a provider, because it doesn't hurt, it can't hurt you, it's only an upside for everybody. Not only that, your patients and other patients who are going to be searching for providers through Slingshot will have access to your information. So that's so important that these people need to understand that you're starting small, but it's going to grow and it's going to grow bigger and bigger. Get in now while you can.
The bigger the network of patients and providers, the better we are able to do what we want to do in healthcare, right? And if I could, feel free to like us on Instagram and Facebook. That's also very important, so you keep up with the happenings.
Right.
And I appreciate the message that you put out today on your Instagram page. That was really awesome. Thank you.
Well, we are extremely happy about the relationship. I mean, this is something that we've been looking for a while, and finally we're able to really be part of your system in conjunction with our medical membership, to be able to offer this to patients that are not members. I mean, our members have access to our facility, and Gina, do you want to talk a little bit about our membership? I mean, every chance we get, we need to promote, because you need to know what we're doing for you if you don't have insurance. I always say, Gina, what do I always say? If you don't have insurance, you gotta be a member of Formé. We mean that, okay? Right. You can tell we're serious.
And actually, through that as well, we can also link you with our community partners that work with us with the services that we don't have, to be able to onboard them as providers, because we're trying to get the best prices for our members. And although our community partners have negotiated rates with us, if they can get a little better, then
That's
kudos.
good.
You know what I'm saying? So it's exciting for our patients and our members to know that there could even be a lesser amount that they could be paying.
And for people that have not yet tried your services in your facility, this is an easy way for them to get that first kind of a test drive at a price they can afford. There's no doubt in my mind they try it once, you guys will have them forever. And
well, listen, I have the app. Do you have an app?
We're mobile web.
Oh, okay.
So slingshothealth.com/Formé.
Okay.
And I believe this month we're doing a promotion for annual physicals, correct?
Yes, promotions till the end of the month that we're going to offer through. You have to go through the Slingshot website, and we are going to offer for the next 2 weeks promotional physicals for $99. So come in, or go online and sign up and come in and book your appointment.
And signing up, again, we're free for the patients. I want to hammer that home. There's no risk here. We're not asking for anything, any confidential information at all. By signing up, you have access to a promotion for annual physical examination, slingshothealth.com/Formé.
That's great. We have a question?
Yes, Lenore is asking, what services can I bid for in White Plains?
Aesthetic services, if you want the vampire facial, which is my favorite, or any of the aesthetic services that we have. Also, we have dermatology, we have neurology, we have internal medicine, urgent care, physical therapy, mental health, GYN, podiatry. So we have many services. Podiatry.
Dentistry?
No, dentistry.
Oh.
Not dentistry. We actually refer our patients. We have a special relationship with some dentists that charge our members a special price. But you can bid on all those different services that we mentioned. So it's and we're live as we speak, right?
Yeah.
I mean, you obviously we have to get to the office because Gina and I are the ones that are approving the prices, right? So mental health, I was mentioning mental health, that was the last thing. To me, this is something that I'm very passionate about, because unfortunately, mental health is something that is so unavailable to so many people. And at Formé, I know that we had patients that were waiting 3 months to be seen at a nonprofit organization that provides those services. And what we decided to do is take it in our own hands, and we actually created a program with Iona College and their students that are doing the psychotherapy, the masters, and they have to do an internship. So they're doing the internship with us, and we have a psychotherapist that is overseeing the care. And we've been able to provide healthcare at an extremely affordable price. So for Slingshot, have you gone into that field of mental
Sure.
health?
And I think it's important for people to realize that there are a lot of services that they may want and request that are not covered by their insurance.
Mhm.
Or we've had several instances where people have gotten physical therapy for less than they would have paid for their copay
Right.
through their insurance. So there's access and there's savings even with or without insurance based on their copays. So mental health is,
It doesn't make sense not to check it out.
right.
I mean, really, just go online, check it out, and book your price and see. I mean, it can't hurt. Like you
Gina, I
said.
think we have another question.
Yes. What if I have insurance? Can I still use a Slingshot?
Yes.
For us, yes.
If you have insurance and you have a high deductible, which is the case for most people nowadays, and it's gonna get worse because I'm speaking to so many people that have insurance and they're saying, I'm so uninsured and I am paying these high deductibles. And so this is the perfect solution for
Yeah.
people like that.
So a lot of people have high deductible, actually almost 40% of all Americans have high deductible health insurance. Some of them will never reach their deductible over the entire year. So if you're gonna need or you want healthcare services, why pay a pre-contracted price when you can negotiate and bid for the same service, same quality of service at a lower price?
Right, and it's, you're really using that insurance as catastrophe insurance.
And that's the way.
Because there's, like you said, there's no way they're gonna reach those deductibles. And I just wanna be really clear that if you bid for these on a Slingshot, we cannot bill your insurance, so it's not gonna go towards your deductible. So what you pay out of your pocket is coming out of your pocket. I need to be very clear with that, because we can't accept one price when we have the contracts with the insurance companies. So, but it is done, I mean, it's doable.
It's
It's
being
usually,
done.
like you said, it's usually the price of your copay in some of these things.
Yeah, or less, and it's being
Yeah.
done a lot, by the way. And what we're gonna do is we're gonna actually provide, we have a system that will provide access to healthcare for people at a price they can afford, which is really the goal of healthcare,
Yeah.
right? Right now, it's so opaque and it's so expensive and it's so inaccessible. People wait 30 days, right? We don't ask where you live, right? Your country of origin. Everybody should have access to healthcare. There's no reason to get sick because you're afraid to go somewhere or you don't think you'll be able to afford it. Put a bid out there. I am sure that it'll be acceptable.
And an important question, do you have this in Spanish?
Not yet.
Not yet.
Ay.
Bueno, ay Dios
Ay,
mío.
Dios mío.
Bueno, para mi latino vamos a trabajar en esto, ¿ok? To be continued.
That's in our to-do list, but right now we have so much work to do, just trying to get access to so many people.
Mhm.
But yes,
Okay.
we're here for everybody.
Alejandro, we have a question.
Yes. What is the benefit for doctors?
So for doctors, that's actually a great question. On average, each doctor has 4 openings per day. And that translates into a loss of significant revenue in excess of $100,000 per provider.
Wow.
So almost like an airplane seat. So when that plane takes off or when that visit time expires, that's a lost opportunity. And providers are not here. Very, very few doctors are here just focusing on making a really good living. Most people that go through what I went through are in it to help people. We have just been put in a position where they make it so difficult for us to help people.
Yeah.
So we take those 4 openings, we bring it to the marketplace at no risk and no charge for the provider. So I took 11 bids last week in my practice. And the reason, there are multiple reasons, not that I just don't want to see it, I don't want to have a half-hour slot go unused, but if I can make a relationship with somebody by a term, then that's a win.
Right.
And I happen to do a lot of pro bono work. 2 Fridays ago, I spent half a day in my surgical center just doing charity cases. We're here to help people. If we can find a better way to do that, or a new way to do that through Slingshot Health and accepting maybe lesser bids than we would normally accept, then so be it. It gives us a lot of opportunities to do what we have been programmed to do, to just help people. And this is hopefully a way that we can find our way back to the way it used to be 30, 40 years ago. It's really
I
very
think you
simple.
should start coming up and seeing some of our patients, right? I think we can, he has nothing else to do, right?
I actually offered that, so I'm always available.
We're gonna take you up on that. We have another question.
Yes, Susie is asking how will work for a person that has hypothyroidism and how will the plan work for it?
For hypothyroidism?
Yes.
So they can go on they can select under internal medicine or primary care hypothyroidism and bid for that visit. They will see the average price for that visit. The doctor knows, and the advantage to the provider is we know your age, we know what you want to be seen for, exactly. Whereas in my office, if I see a new patient, they're not going to say hypothyroid, just going to new patient. So we'll know about, the bid and what we want to take or what, arrange where we want to take it. So we're ready to see that patient right off the bat. And that's really important for us to understand and the patient to understand that even before we've met, we know what's going on, and we have a mutual alignment towards providing that health care for that patient who wants to receive that health care.
And if the patient, because if you're coming in with something like that, you're gonna need your levels checked.
Right.
So
we
blood
have
worker is involved.
we have that taken care of already. So in Manhattan, if you need blood tests, which a lot of patients do, you put that bid out. You can go under blood tests, select the type of test that you want. It'll tell you the average price, and that offer goes out to all the laboratories that can do that blood test for you. We're actually getting annual physical examination labs, a whole huge profile for about $120, $130 for patients now. A significant savings.
Yeah,
So are you not negotiating? I keep going back because
Because
that's what we do.
We
We negotiate for the members, but so you are getting like Quest Diagnostic, any national lab that is participating?
Yeah,
Or?
I can't mention names.
Okay.
But
Okay.
yes, these are
So they're
very reputable labs.
labs?
Yes.
Okay.
And
Right.
also, if you do need labs, like Maria said, we've negotiated rates as well. So, if sometimes usually what happens is they pay for a visit, right? They'll come into a visit and then they'll need something else.
Mhm.
So right then and there, at the time of service, we can tell you exactly how much it would cost for your labs that we've negotiated with the lab company. And we're actually revisiting another lab to get even lower rates. And it's not just for our members, it's for any cash payer.
Right. I think
So-
together what we'll do is we'll give people more cost-effective access to healthcare
Yes.
as we grow together, right? We'll have the weight of all these people that want to get healthcare, and we'll have providers that want to provide the healthcare for the patients.
I mean, we really should be going to Albany and speaking, or Washington, and speaking to some of our government officials, because between the two of us, the two companies, we've really taken care of a lot of issues. Mainly, I have to say, transparency in healthcare is something that I have been complaining for so long. I remember my son got a motorcycle and he fell. I saw him falling. I almost died. I didn't want him to get a motorcycle, but when he broke his hand, he said to me, I couldn't believe that I got a bill for like $400, but I didn't know. Like, why? And he had a deductible, and he was saying, how is it that in healthcare, like any other business, you go and buy a TV, you know how much you're gonna pay for the TV. You go in healthcare, you never know. You keep getting bills left and right. I mean, I had to go to the emergency room. I have insurance. I gotta tell you, I come out of there with a $3,500 bill. And not only...
And she's insured.
And I'm insured. And it wasn't like I got a bill for $1,300 and I thought that's what it was. Then 2 weeks later, I get another bill from another doctor it's crazy. So we are the bridge. There's a gap, right? And we are the bridge that is closing that gap. We are transparent. We are all about dignified care. That's what we want to bring to the community. Dignified care. Right, Gina?
Absolutely, and the other thing is don't wait. Because what people do is they wait until they're really sick.
Yep.
They wait until the last minute. We are very, very pro into preventative medicine. And we are pro in getting your baseline, know where you stand, because people are walking around with diabetes, with high blood pressure, with hypertension, and they don't even know. And they're just thinking like, well, I'm fine, I'm healthy, meanwhile you're not. Get a baseline. I mean, this is what we're here for. And now you're gonna have your own price. So it's very interesting, and I think that's what people need to understand is don't wait, because next thing you know, you're going to be stuck with a bill that you cannot afford.
You set your price, tell us what you want, when you want it, and we'll do our best to make it happen.
Dr. Berman, unfortunately, 30 minutes go so fast. I'm always blown away when we start our show. We're like, 30 minutes. It just goes so fast.
Right.
So, but we are at the end of the show. We want to thank you so much
I
for
appreciate
really
your time.
coming, to join us on this Facebook Live. But more than this, obviously, is the partnership that we're
Thank you.
creating to really make a difference in our community. Gina?
Yeah, we're so excited about it.
I
And
appreciate
we're going to do great things, so you guys got to stay tuned and make sure you have your link for slingshot.com, health.com, as well as formaymedicalcenter.com, and you're going to see amazing things in this partnership.
And thank
Like
you very,
us.
thank you very much.
Like us
Yeah,
on
like
Facebook
both
and
of us on Facebook
Instagram.
and Instagram, please.
Thank you so much for following us. Kiss
See
to
you
all
next
of you. Take care.
See you next week.
Bye-bye.
Bye.